Hi everybody, Kristen Shorts, PCC Adventist Health Simi Valley. Excited to talk to you about Pulsara, using the communication tool to send the image of the 12 lead from the pre-hospital setting into the emergency departments. Sending that image as your STEMI pre-alert is very helpful, and then following it up with your base station contact. Sending the image to the emergency department allows for not only the emergency department physician to see that image, but then also the cardiologist on call as well. Having the physicians also objectively look at that 12 lead and be able to evaluate based off of the scenario allows us to activate our cath lab, but also potentially not activating the cath lab. So it is giving us good, adequate, confident 12 lead review. We want to help decrease false activations of the cath lab in terms of utilizing equipment and resources that are not necessary at the time for emergent use for specific patients. It reduces cost savings to all the hospitals, and I know at Adventist Health Simi Valley during the trial period it was a drastic reduction of false activations, which then allowed us to put in budgetary items for advancements in the cath lab just off of that single year savings. So utilizing Pulsara is definitely patient focused in terms of speeding up door to balloon times and allowing the team at the hospital to be able to evaluate that 12 lead right along with you at the same time. Additional items that we could see using Pulsara for in the future, there's a lot of tools in the app. As you become more comfortable with it, please talk to your agency, your PCCs, in navigating through potential uses for the app. Taking images of traffic scenes for general patients, communicating a BLS contact via Pulsara instead of a regular telephone landline. MCI components in there as well. So a lot of tools in Pulsara that more to come, but 12 leads are our focus right now.
On every rig iPad, the app Pulsara will be downloaded. You're going to go ahead and use the login information that you created. Once you're in, you're going to select the team member. This will be whoever your partner is that you're working with that day. After you've selected those people, you're going to make sure that you select the correct unit number. At this point, the rig phone number should auto-populate. Please double check that it is your rig phone number only. Once you're in, you're going to click New in the bottom right corner. You're going to click the time that you first contacted this patient. It should be your arrival at patient date that corresponds to your EPCR. From there, you can go ahead and click Unknown and Unknown for the name. You'll want to include an age so your patient is identifiable with base. Click the gender, and then you're going to select patient type. Once you have your patient type selected, you're going to go ahead and give a brief description of what the patient is experiencing, whether it be chest pain, chest pressure, weakness, diaphoresis, whatever the symptoms may be. You can give a little bit of an explanation here, keep it short. You can also include any treatments that you have already done or plan to do so that base can be notified in this very short STEMI pre-alert as well. Remember that this does not substitute for a full base contact, so this is good to give some brief information so that MICN is aware of what's coming in, but you're going to be making a full base hospital contact to your base hospital in addition to this STEMI pre-alert. At this time, you're going to select the destination. You'll choose your closest STEMI center. Your ETA should auto-populate based on your GPS location. It's now time to upload your EKG. Top right hand ECG button, go ahead and open up your camera with the plus sign. You're going to try to snap as clear a photo as you possibly can. Be advised if you're using a Zoll printout, you may have to cut and stack the image in order to make it all fit in one frame. If you are satisfied with your image, go ahead and click Use Photo. Then you'll hit Back. You'll see that there's a 1 that's attached to the ECG button. Now it's time to hit Alert, which will transmit the 12 lead directly to your STEMI receiving center. Once you hit Alert, the base hospital will acknowledge the receipt of your 12 lead. You'll follow up this STEMI pre-alert with your full base hospital contact. Upon your base hospital contact, if you are informed that this facility is on diversion, you're going to go ahead and scroll down to the bottom and you'll click Change Destination on the bottom right. You'll select your new destination that will be your next closest and the reason that you are transporting to this facility, in this case, diversion. You now have an opportunity to update the ETA for your new receiving facility. Once you've done that, you'll click Save in the upper right corner and you'll hit Change to officially divert your patient, which will now alert the new STEMI receiving facility. Sometimes there will be patients where we want to get the MICN involved early or have the hospital physician take a look. We have an option to select different patient types, and Pulsara can be used as a pre-alert for many different patient types, whether it be a pre-alert for a stroke patient or a sepsis alert, or even by taking a photo of a car involved in a traffic collision. These can all be sent ahead for review by the MICN or the hospital physician. Using Pulsara as a pre-alert tool can help with patient care by improving communication between EMS and the receiving hospitals. Please reach out if you have any questions about the app.